Hi guys, and welcome to Tglambeauty Bar, where everything is nothing but glamorous. So today's video is going to be about cosmetic surgery, and the cosmetic surgery that I'm referring to is a BBL and a breast lift with no implants. Now, some of the things that made me consider cosmetic surgery was just many years of breastfeeding, and I just wanted a mommy makeover. So I decided to get a breast lift and just get some more hips, a more curve appeal. So the first thing that I did was did 3 different doctors that I researched. The first doctor was located in Delaware, which was referred to me by a mutual friend. That doctor charged $5,000 for a breast lift, no implants. But some of the things that I seen was his before and after pictures, and the after pictures that I viewed at, it still had like a little bit of sag to it, so that was just not the look I was looking for. So then the second doctor that I researched was located in Miami, and that doctor charged $8,000, and he said the only way that he could do my surgery is with implants. And implants is just something that I didn't want to do because it's just a high risk with implants. My third doctor that I researched was located in Colombia, and that was from a mutual friend as well. And I researched and looked at her results. She just came back from surgery. I watched her for 3 months straight, and I was like, that's the look I want. Some of the things that I liked about this particular doctor is he had breast lift with no implants, and the breasts were still like sitting up, still lifted. So that was just something that I really considered for my surgery. So the first step when you want to start the process of surgery is you have to put a deposit down. So my deposit was $500. Once I put my $500 deposit down, I sent in my pictures. You have to send the front view of your picture, the front view of your body, the side view, and the back view of your body. Once my appointment was set, I booked my plane ticket, and I was off to Colombia. My plane ticket was roughly about $500, and I got a good deal on cheapoair.com. So if anybody's looking for that. My next thing, I got my email, and with the email from the doctor, I had to get blood work done. I had to know my weight, my measurements. I couldn't eat. I couldn't take any type of medicine, no Tylenol, anything that's over the counter. You can't have any alcohol for 30 days. No, if you smoke, you can't smoke for 30 days. This is just something to consider when you're going into surgery. So once my flight was booked and everything, I went on my trip, and it was my first time ever going to Colombia, which is out the country, and it was just an amazing feeling, like just getting off the plane and just seeing like this day is going to happen. So it was exciting. And so when I first got off the plane, my driver picked me up and brought me to my recovery home. Now the recovery home is just a place that has full staffs, nurses. You have a caregiver, just anything that you need. So I went to my recovery home, went to sleep, and when I woke up the next day, went to my doctor's appointment. My doctor just pretty much told me what was going to happen for my surgery, and I actually arrived 2 days before my actual surgery day. So the day after was when I woke up in the morning time was my actual surgery date. So when I woke up and went for my surgery, I was just so nervous. Like, it was just so much to, like, you know, to comprehend. But it was just something that I wanted done. Okay, so the doctor brought me to the surgery room and laid me on a surgical table. And there was a nurse there that had to give me an IV. And with the IV, they gave me the drug that put me straight to sleep. So as I'm talking to her, I'm looking at the ceiling, I'm thinking, when is this going to happen? And boom, I'm knocked out. So when I wake up, this is like the funniest story. I wake up, it's freezing cold. I don't know what's going on. My breasts are sore, my whole body is sore. And I'm looking straight ahead, and all I can see is like a group of nurses just waiting for me to wake up. So when I wake up, they're all rushing to me. It's about 4 or 5 of them. Remind you, I'm in Colombia, so I don't speak any Spanish at all. So they're speaking to me in Spanish, and I don't know what they're saying. And they're throwing the faja on me, and I'm in so much pain. I'm like, wait a minute, give me a second. But they have to put the faja on you to keep the swelling from expanding. So once the faja was on me, right away I'm like, I need some drugs. I need, like, this pain has to go away. So they gave me a little bit of morphine, more morphine. So once I was settled in, I stayed at the doctor. I stayed in my bed for about an hour, and then my nurse came to pick me up with the driver and bring me back to the recovery home. But the whole drive through, thank God I brought my BBL pillow. The whole drive through, like, it was just so bumpy and painful, and I'm just like, I just want to just get in my bed and go to sleep. So as soon as I get back to the recovery home, I'm going straight into the bed. I don't want to eat nothing. I don't want to talk. I just want to go to sleep. I'm in so much pain. So the next day when I wake up, I'm feeling a little bit better, but just still sore. It's just like the kind of soreness that you get is kind of like you working out all day and your body's just tense and sore. Like and if someone touch you, it's just so painful. Okay, so the next day was my first massage. With my package, I had a 10-day package. So with the package, it included, only thing that it didn't include was my airline. My airline was $500. I had to put the $500 deposit down for the actual surgery. The package included the recovery home. The recovery home was additional $1,000. The package included the food. It included all my doctor's visit. It included transportation from the airport back to my doctor's appointments, to anywhere you need to go. So it was worth the package. So overall, I paid roughly about $6,000. That's with the airline included. So it was worth it. But when I got back, back to my first massage. So the first massage that I got, I had 10 massages included in my package. So the first massage I got, I'm thinking it was going to be a breeze, like, oh, I'm going to get a massage, I just had surgery, it's going to relax me. No, it's nothing like that. Your first massage, they're trying to drain the fluids from out of your body. So them pushing the pressure on your body with the soreness is just so intense. It's not what you think that it's going to be like. No, it's going to hurt, it's going to be sore, it's going to be very painful, so just look forward to that. So I got 10 of them. As like my 10th massage, I started to feel a little bit better. So that was the 10th one that I actually felt like it didn't hurt anymore. So I had a daytime nurse and a nighttime nurse. So my daytime nurse was awesome, like very awesome. Like another thing I was going to tell you is that when it's time to use the bathroom, I had to get assistance and have somebody bring me to the bathroom. It's hard for you to sit and use a faja, like when you're trying to use the bathroom, because you have to keep your faja on at all times. And the faja that I got, I had to get the zipper adjusted. So my zipper came from my stomach all the way down to the back side of me. So it was easier for me to just zip it down and use the bathroom. So I suggest if you're going to get a faja, make sure you get an adjustable zipper. It's just easier for you to use the bathroom. And my first shower experience, I had to sit in the chair because I was just in so much pain. The nurse is always there for you to help you, to assist you with anything you need. Use the bathroom, shower, anything. We have a caregiver that makes food for you, so you're never hungry. You could tell the caregiver whatever you want. The doctor that I went to was Dr. Rafael, and he is awesome. He just made me not feel nervous about it. He made me feel comfortable. After getting the surgery, he kept up with me. He sent me messages, text messages, emails. He's also really big on Instagram. You can message him, he responds right back. So just want to make sure I'm not missing anything. So this is more of like an updated video because I had my surgery back in May, on May 31st, which was of last year. So this May will make it one full year. Let's see. Okay, so another thing that I would recommend too is when it was time to go back on a plane after surgery, I purchased a BBL pillow, which I will include in this video. That BBL pillow was like God to me. I used it for everything. I used it to go to sleep because when you go to sleep, you're still sore. So I put the pillow underneath my back. I had one underneath my legs, so I could feel a little bit comfortable. Now, the thing that I would say, because this is my first surgery ever, and I had got a breast lift, and I had got fat added to my hips. So I didn't get a full BBL, but it's still considered BBL. And the thing that I would say is that because I got both done at the same time, my breasts and my hips, it was hard for me to sleep because it was like, okay, I can't sleep on my stomach because I got my breasts done, and I can't sleep on my butt because I got my hips done. So it was like, no way that I could sleep. So the best thing I would suggest, if you're going to get everything done like I did, is to get a good pillow that's really supportive. So, let me see. Okay, so going back on the plane. So when you go back on the plane, you're going to need that BBL pillow again. Now, I was being cheap and I didn't get first class. I wish I would have went with first class because there's more room. And I just had regular coach seats. And it was so uncomfortable the whole entire ride. Like, I had the BBL pillow on me, but my legs started to get numb. And then you got to wear the compression socks. The compression socks, you know, with the BBL pillow had my legs just completely numb. It was just like an uncomfortable ride. And like, my plane ride was 5 hours, so you could just imagine being on a plane for 5 hours. Like, it was the longest trip ever. When I went home, some of the things I had to keep up with is I had to keep my EpiFoam on. I had to keep my ab board on. The EpiFoam is just like a foam that goes, it relieves the pressure from the ab board. The ab board goes over the EpiFoam, and that pushes the EpiFoam against your stomach, and that pressure keeps the abs flat. And then I wore my thigh high. So I had to continue wearing my thigh high for additional, I believe, like a month and a half. So another thing my doctor told me is that you can't go back to work for a month, roughly a month and a half. You can't go on the beach or go in the pool for 6 weeks. Okay, so after I booked my appointment, my doctor sent me an email, a more detailed email, and with the email, which I'm going to include in this video, it just states everything that you can have, what you can't have. For example, you can't have any Tylenol or over-the-counter medicine. You can't drink alcohol, so just consider that. You can't have alcohol for 30 days. That was the hardest thing for me. You can't smoke any hookah. I don't smoke, so I didn't care about that, but you can't smoke hookah, you can't smoke cigarettes, anything. You can't smoke at all for 30 days. What's another thing that's in the email? I'm just going to include everything in there. Okay, and then after I came back from surgery, I had to take care of my body with continuing to wear my thigh high, continue to wear my ab board, my EpiFoam. I had to start the my scar treatment, because you are going to have scars if you on your breast. If you get a breast lift, the scars are going to be, I have my nipples reduced, so the scars are going to be around the nipple. It's going to be a line going straight down. It's going to be a line going across. I think they call that a lollipop. So just consider that you're going to have scars. Now, my doctor told me that it takes a good year for the scars to go away. So what he recommended to me was silicone gel or the silicone scar sheets. So I'm going to show a little clip of me being in the studio of my updated look on my scars so far. And I'm still working on it. Now, I will say that the first month or two, I did use the scar treatment, and then I stopped for a couple of months. So now I'm back on it again, and I'm still working on my body, on my scars. So just consider that you're going to have scars, and they're going to go away. So just be patient. If you like this video and you want more videos like this, please subscribe to my channel. Please give me a thumbs up. And if you want to follow me on Instagram, I'm going to have my information below. Thank you.